Hello, I'm Raul Santos. I'm the president-elect of IAS, and on behalf of Professor Jean-Charles Fouchard, I'd like to give you the welcome for this very interesting and important meeting. It's a real honor and pleasure to have you all. You are the specialists on this disease, right? You represent science, you represent your countries, and it's very international. And actually, this is within the scope of IAS and also ARCUBI. So really, really welcome, and thanks for coming to this amazing place. We have been living exciting times, right, on the lipid field. We have conquered LDL, but we still have a long way to go with triglyceride-rich lipoproteins. And the problem is that with these epidemics of obesity, atherogenic dyslipidemia certainly is the most frequent kind of dyslipidemia that we have nowadays, and we still need to conquer that in order to reduce cardiovascular disease in our countries. So a meeting like this one, where we're going to discuss the advances on the field, and certainly you're going to hear from the best specialists that have been working. Actually, they made careers on that, so that's the beautiful thing of this. So we really will be able to hear and to learn and to discuss and to propose, because the idea of this is actually to come in a document that's going to be a joint ARCUBI IAS document on the atherogenic dyslipidemia and the SPPARMα alpha agonists. So, and we believe that this is the next step, right? After cholesterol, now we're going to have triglyceride-rich lipoproteins, and as long as we have the good ways of reducing these lipoproteins, and we have a well-designed clinical trial, and we're going to discuss prominent, right? Certainly we will be able to make the difference for the patients in the future. I'd like to pass the floor to Professor Fouchard. Thank you so much.
So good morning, everybody. It's a great pleasure to welcome you in France and in Chantilly. Chantilly is very special. There is a wonderful castle, and you must know that this castle was done by a king for his mistress. So this was another time. So more seriously, welcome to this meeting. This meeting is very important. We were thinking in ARCUBI and in IAS that we could invite perhaps 50, 55 people in order to have 25. But we are 53. So it means that everybody is coming. So thank you for coming. And I would like to say some words about the ARCUBI. ARCUBI is a foundation that it is academic foundation that was created 10 years ago, exactly 10 years ago, with a meeting in HA with colleagues like Virgil Brown, like Frank Sachs, like Jean d'Avignon. And at this time, we did, and many others, many of the members of ARCUBI are in this room. And in fact, it was created to study residual risk after statin. When you look to all trials done with statin, you see immediately, and the Oxford study was the first to demonstrate that, you see immediately that 70% of the patients after statin trial are with residual risk. And this residual risk is due perhaps to triglycerides, but perhaps also to vascular inflammation, or the combination of the two. And during 10 years, we were we were focused in Hercubae on this residual risk. We have a website free of access. We have a wonderful medical writer who is in this room, who help us to put the bibliography on residual risk each month. And we organize meetings. 2 years ago, it was in Kyoto. Last year, it was in St. Petersburg in Russia. And now we have this very particular meeting. It is a consensus meeting on selective PPAR alpha modulators. You know, we did a consensus meeting in Hercubae. It was a long time ago, and I think Jean-Pierre Després is here, and we did that with Alberti, Zimet, Grandi for the definition of metabolic syndrome. And it was very successful. We did a paper published in Circulation and accepted by the majority of people working on obesity or diabetes. So now we want to do this consensus meeting on selective PPAR alpha modulator. And our dream is to have a consensus and to prepare a paper submitted to everybody for correction and to send this paper in a big review, like Lancet. So it could be wonderful if we can succeed. It depends of you, of the rapidity of your answer when you will receive the first draft. But I think it's a good objective. So again, thank you very much. You know, we have many colleagues from all the countries, and particularly we have many scientists, absolutely outstanding scientists from Japan, because the drug has been done in Japan. So thank you to everybody. Thank you for people from US, because it was Thanksgiving, and some of you are not present. Some will come this morning, like Peter Libby. But the problem is everybody is coming. And it's a pleasure to welcome you. It's a pleasure to be with you again. And I will let the chairman, chairwoman, to start this meeting.